Welcome to my word. Welcome to my channel. I shall, as usual, make clear my mission. My mission is very clear: to create that necessary, strong symbiotic relationship between you, I mean the public, and the medical laboratory scientists, so that always the health, you continue to live in perfect health, which is very necessary for a very strong economy, Nigeria. I shall try today to expose us to the deadliest, one of the deadliest pandemic, that is the HIV pandemic from 1981 till date, but which has been brought on hold by a united effort from the world leaders through Global Fund. I shall also talk about the laboratory diagnosis, but first, let us click on the like button, press the subscribe label, and also let us do the needful. You can also press the bell, notification bell, so as I move into the laboratory diagnosis aspect. Thank you for listening. You're welcome back. I welcome you into my studio. The topic, as earlier said, is diagnostic laboratory aspect to HIV AIDS study and anemia. We know from the year 1981 that HIV was ravaging the whole world, and you can imagine the extent of the problem. At first, it was not clear what the virus should be called, whether it should be called human T-cell lymphotrophic virus type 3 or gay-related immune deficiency. So this was debated until in May 1986, the RNA retrovirus was named by the International Committee on Taxonomy of Viruses, officially named it HIV. The HIV name continued, and we've been able to group them into two: the HIV-1 and HIV-2. The HIV-2 is very resident, endemic in West Africa, Nigeria inclusive, and we all know that it's sexually transmitted, both homosexual and heterosexual. But I think the homosexual aspect is what really brought it to limelight. It's also surely transmitted through blood, infected blood, and sharp objects. If HIV is left untreated, that's when it gets to the AIDS, when all the symptoms and illnesses will develop. It is very easy to come to that conclusion because the HIV virus itself attacks the immune system. That immune system that is attacked, it is inside it that it will even live and produce its kind. So the layman definition of HIV, we all know that in Nigeria, for example, there was no acceptance. Nobody wanted to accept that this is true, that there is a disease that you don't have to have sex. So they just coined it American invention to discourage sex. The Minister of Health, Professor Akinola-Anjou, as late as 1997, you can imagine a disease that started in 1981, that even as at 1997, he had to come out to claim that his brother, very unethical claim, but he had to do it so that more people will be aware and save themselves and stop the spread of HIV. Over 1.8 million Nigerians are enjoying are living with HIV and enjoying the treatment, because you have to you manage HIV infection for life with the treatment. This is the shape, the picture of the HIV virus itself. You can see this. The inside is the enzyme that helps it to really produce its kind by reversing transcription, so it can enter into the nucleus and produce the messenger RNA that will initiate the production of its RNA. This is something very worthwhile that we must be careful about. All the protein, generally, once there is a protein, of this outside protrusion, we call spikes, they elicit reaction from the immunoglobulins. The immunoglobulins consider them as antigen because the foreign protein will elicit reaction from the antibody immunoglobulins, and the body produces antibody against them. But the one that is the core protein itself, P24, which doesn't mutate more, it stays almost as it is the difficult one to really produce antibodies against, because it's inside. You can see it embedded. All these ones are changing, they continue to change. That's why HIV has been difficult to really eradicate totally. The efforts of the world leaders can be brought into focus. As far back as 2003, President W. Bush initiated this President Emergency Plan for AIDS Relief, because called PEPFAR. It was so rampant that people were becoming vegetable. They were wasted. It was very dreadful. The global HIV AIDS initiative, we call it WAIN, well, it was Nigerian, designed to support the Nigerian government, and indeed we were really supported, because I was part and parcel of that program. We had workshops and seminars, and we attended NHOD, and there were materials being circulated for advocacy, and people were counseled so that they can come forward voluntarily to be tested. And after testing, the treatment follows. The testing method there will be I'll talk on it in the following chapter when I speak more on the laboratory diagnosis. But the laboratory effort, the medical laboratory scientist effort, as late as early as 2000, around the period when the WHO declared December 1st as World AIDS Day. I think that was in 1998, but we took the initiative to come out and speak that HIV is real. People still do. I remember somebody telling me even at this 2000 that it's something done. The America is inventing against sex. So many people did not believe. So you can imagine the effort we put in to let people know. So we came out. All those you are seeing are medical laboratory scientists. No dilution. That is not only that we are working behind the scene, but we are even coming out to tell you that this is what we are seeing. It is for real. It is real. The medical laboratory scientists and HIV continued because HIV, we are very lucky that the world power put so much money into it. Even with that, it still remains one of the world's longest pandemic. It's still there. It's still threatening life. It's still wasting people. It attacks our immune response, like I said, the CD4, the one that is supposed to protect and attack any foreign body, any foreign antigen, is what the HIV virus itself will attack. And when it attacks it, it now feeds on it to produce more of its kind. Very serious. So the fact about HIV is that testing regularly for HIV must be supported with antiretroviral treatment to stay healthy. If we are able to confirm, the laboratory scientist is able to confirm that you are positive, which is no other remedy than for you to start the antiretroviral treatment. You must stay on course. You must stay on the treatment so that your CD4 count will now start rising again. The viral load will now be reducing, and this we will continue to check from time to time. We will check your CD4 count to know whether your CD4 count is rising above up to 40 and above, which is where we start saying yes, there is a strong resistance being developed. Your immune system is being developed, and the viral load is now coming down to probably undetectable level. And NACA, which is the Nigerian aspect of really does the coordination, collects all these facts and figures and do the mobilization of people with the aid of PEPFAR and global funds. These things are well supported. If you like all I am doing, please subscribe. Press the subscribe label and the notification bell to press it. You can click on the like button, and for sure the program will continue to meet your standard, the standard you really want for the program. The risk of acquiring HIV in 2020 has reduced, but regardless, you can see when you try to divide or partition who and who are more prone to it, you find that 35 times higher among 35 times higher among people who inject drugs. That 34 times higher for transgender people who go for this changing from man to woman, and then 26 times higher for sex workers, the prostitute, but 25 times higher among gay men and other men who have sex with men. Seriously, it calls for. Yes, let me use this time out to thank the lady, Mrs. She used to be a very senior police officer, Mrs. Shola Okiria, who really gave me the assistance with the pictures that we used around December 2000 when we did the march. We work for HIV awareness. She really was very useful. We can now go on into the aspects that really concerns the laboratory diagnosis. Though in the 80s it was very crude method we used. We didn't have to follow any rule. These days you have this type of safety measures, the WHO standards. Though this is almost about safety level of about safety level 4. For the HIV, about safety level that is still acceptable is the level 2. We still use level 2 about safety method so that we are safe, but with the COVID-19 virus, you use about safety level 4. This is like this. It's an area where nobody comes out. Once you are in, everything is done inside, and there is no way you can really infect outside. There is no window for you to. It's all packed. So the air inside is sterilized, so everything is perfect. The ones we are used to now is you make sure that there is no problem, and the level of involvement, your contact with others is reduced as well. But you can still make contact with people outside. Very easy with patients. You can make contact, but your lab coat and your protective wear, safety wear is very primary that you really wear them well. The laboratory scientists would, as usual, make sure that the samples are collected, and after collection, they are taken to the separate showroom where the plasma or serum for the parameters are used. We must understand the first stages of HIV disease. The primary stage is the stage when you have the window period, you will not even see any virus if you collect any blood. Later on, within 25 days, it's seroconvert, and then you get into the stage of incubation, from where it entered the third stage, the early stage where the symptoms are, you see the symptoms. That period when you see the symptom is still okay, but the late stage when the virus is not attacked, or the virus problem is not attacked, then you now have the AIDS experience, because at that stage all the CD4 count has been reduced. The body is like an open system. The thief can enter from any angle. The attacker is now bringing in other diseases. So that is the level of stage 4, when the virus has made the body very vulnerable to diseases. So you can understand what the body will get exposed to at that stage, when there is nothing protecting the body anymore. The test that is done in the 80s is more of a qualitative test. We do ELISA, serological test. ELISA, I can still remember we use immunocomb, and we just do the qualitative test to see whether the HIV is there, positive or not. But these days, it's a more or less a quantitative test. After the separation, you go on to do greater work using machines that are state of the art. The machines really give you the quantitative result you're looking for, and it starts these days. Nowadays, with doing the determine, that is, you use a serological test that is highly sensitive. When the patient comes around, you don't know whether the patient is HIV positive or not. So the first thing you have to do is confirm by screening. You are not really confirming, but you are screening the person to know whether there is HIV likelihood in this person. Though it's looking, showing the signs, but the medical laboratory scientists still have to confirm using the diagnostic method that which confirm that the patient is positive. So the first stage is just to use determinants, which is one of the things that would you could call qualitative method of knowing whether there is a virus, HIV virus, in the person's blood, because you have already collected the samples. So you want to check, is it there or not? What you are testing, if it's positive, good, then you can proceed to do the quantitative test, where you now do the viral load. This is the viral load machine, the PCR machine that you test. You can see the laptop, it's also giving out the readings, and this is the scanner. So as we load, we must label it. This code, this one is coded. The scanner will decode it and put it rightly. After the viral load machine, which I am supposed to use as the PCR machine, what it does is to really, after they are probed for the virus, the probe does not get into the the PCR proper test. The primer is now used in the viral machine to really have amplifier number, to amplify the number and know the level of the viral load. The viral load tells us how heavily loaded, that is, the level of the virus in the patient body. So the treatment is already started once it's confirmed. There is no second wasting of time. But the viral load is taken to exactly know the stage at which we are starting the treatment, so that if the viral load is high and the treatment is started, you can use the viral load results, the next viral load result, to know how effective the drug that is being administered to the patient is. The stage at this machine is the CD4 count machine. BD5 counts. It really gives you the quantity of the CD4 in the patient. In the normal patient, you expel between 400 to 500 and up to 1,600 counts of the CD4 when you read it in this machine. If the CD4 is below that number, is below 400, then you start knowing that the virus has been doing the serious damage, destroying the CD4, the lymphocytes, T lymphocyte that really attacks the virus. But now the virus is now the one attacking it, destroying it. So the work of the CD4 is now overtaken by the virus, turning it into its food. Nature is so difficult to understand. What you think is protecting you is now being turned to food. The virus is now eating it and making it its daily meal. So the number of lymphocytes that CD4 lymphocytes are produced a day is over 10 to the power 9. You can see how the body really protects us. The lymphoid cells, both the B cells and the T cells, they're so highly numbered. They are specific. They go after the specific foreign bodies that is alien to them, and so they want to destroy it. But now it is even itself. It's when the hunter becomes the hunted. The hunter is now being hunted. The HIV is now hunting the hunter and destroying the hunter. So if the CD4 count goes very low, we are becoming going to the stage of AIDS. Like I told you, that is when all is less loose. So you find that the patient is seriously debilitated and in a state where there is wasting. The body is wasting away, and there's stooling, and all kinds of diseases are happening. But we thank God that we've been able to find the drug that could kill and reduce the population of the HIV virus. So when the population is killed, the virus level is reduced, then the CD4 count goes up. It goes up. From the moment you start getting 400, 500, then the patient is recouping and living a very healthy life. So you can see the importance of the laboratory in management of HIV. The other machine is the selector machine, which we use to check the chemistry, the level of the blood chemistry, so that and then we talk about anemia. This machine helps really to analyze the level of the blood, the PCV, makes use of the PCV, gets us the value of the PCV, the hemoglobin concentration, the MCHC, and even the different cells, differentiates the myeloid cells, the polynuclear cells, monocytes, the eosinophil, and all of them that are higher in number than the lymphocytes. But nevertheless, when HIV is rampaging, the blood level is very poor. You find that the patient is anemic, and the picture is a serious one. So this machine helps to confirm the level of anemia in that patient. So we expect HIV patient to be anemic. So like they always say, with the chick and the bear, which one comes first? In all sincerity, probably the patient has always been anemic before contacting the HIV virus, or the other way around. That although we know with HIV, the white cells, the platelet counts, especially the platelets, are reduced. So all that will defend the body they become low in number. You can imagine that is how deadly HIV, as far as I can say, is the deadliest. But we are so lucky that there is a cure, but there is a treatment, because up to now nobody has been declared 100% cured. But there's a treatment that helps improve the health of the patient, manage his health, just like you manage hypertension. The HIV is now being managed, and people are living healthy life. So it pays for the patient to be detected, to come for early tests. It's advisable for people to check their HIV level, especially when their lifestyle is among the group that would normally experience HIV infection. We know those groups. If you live a promiscuous lifestyle, whether you are married or not, it matters not. You are prone to have STI diseases, and HIV is a sexually transmitted disease. 41 years of the HIV pandemic management, the achievements so far can be put under these basic rules. That is ABCD. I remember those days when even Professor Wosu, the Minister of Health, will also come and tell us the ABCD. So we should always remember the ABCD. Unlike these days where you want to protect yourself against COVID-19, you are asked to really observe the protocol, the COVID-19 protocol. Now, this was more or less the protocol for HIV, and it still holds. A stands for abstinence, abstain from sex, if you can do so well, or then make sure you stick to one partner. B, behavioral change. It's also very close to abstaining from sex, mixing with people who use injection, the life of being prone to sharp objects, and their lives, they just live free life anyhow. Then the C is the use of condom, that if you must have sex, it's better you have a protective sex. Use condom. D, the drug penetration. Do not abuse drug. You find druggish, they always inject themselves. Right now, the HIV has seriously been decimated. That is, it has shown an improvement. We have really improved with the management. 28.2 million people were assessing the antiretroviral therapy. And by the time we calculate from the inception to June 30th, June 2021, 37.7 million were living globally with HIV in 2000. So you can understand that as the 28.2 million, we are talking of the present situation up to this period. But globally, the people who were living with HIV were 37 million plus. Whether they had the opportunity of this, but usually when you are positive, you are given the opportunity of. There has never been a situation where there are no drugs to manage treatment. That's the world powerful nations have ensured. 79 plus were infected with HIV since 1981. This is the figure that I was trying to get to. 79, almost 80 million people. You can imagine what the number COVID-19 has probably reached. Probably less than 6 million now. But this one has gone beyond 79 million infected, and out of which death has been 36.3 million people out of that have died. So you can see how dangerous, because when you consider 36 times 2, it's almost half the people that experience HIV die from AIDS. Can you imagine? So it's better for you to stay far away from it. Maintain the ABCD. Maintain it. Live a life. Let your lifestyle be something, because all these diseases and problems that we experience are cutting from our lifestyle. Then we should try and make sure that we are not anemic. Visit the lab regularly, check your blood volumes, maintain your immunity, immune level, and you are happy because the hemoglobin level, that is, if you are not anemic, then your immunity is assured, because your immune level is more or less assured. I don't think there's a better test to get at that than the anemic level, which take cognizance of the micronutrients and the minerals, especially iron. Since 2010, infection with HIV is down. That's gone down by 31%, and right now 2010 till among children too, since 2010 up to now, we have a situation of 53% amongst children. So the 41 years experience is really we are making breakthrough, but we need to thank the global funds, that to fight the money pooled together. Earlier I had spoken of the President W. Bush, who started the concerted effort. We need to thank all of them, because they have really done so well. And the Global Fund is really set to fight, and is still fighting against HIV, the AIDS, tuberculosis, because people who have AIDS usually experience tuberculosis is associated with AIDS. So the next talk I shall be having shall be on the medical laboratory scientist aspect and the management of tuberculosis. Later, maybe I'll go on to malaria, but I will have to see the opportunity. So always subscribe, press the like button. Your subscription really improves the quality of the services rendered. The contents will be highly standard. So the Global Fund to date done data research in 502 health facilities in 32 African and Asian countries. The HIV reduced by 41%, and referrals for diagnosis and treatment reduced by 31% during the first COVID-19 in 2020 compared to the same period in 2019. AIDS-related deaths have been reduced by 64% since the peak in 2004, and by 47% since 2010. So we need to really thank our stars for all these achievements. We thank God for His love over His people, because God's mercy has no end. And I want to thank Mrs. Atewe of the she's a medical laboratory scientist that also helped in the quality of the equipment used. She's been so helpful, and I thank her, and all those who have contributed by encouraging me. The president of the Medical Laboratory Scientists Association of Nigeria congratulating me for doing very well with this project. But regardless, subscribe. Press the like button. This is the way to encourage the content. You want the content, and believe you me, every Thursday at 7 p.m. the program will be on. Thank you.